Kia ora, my name's Chelsea and I'm the co-chair of the CDHB Youth Advisory Council.
And I'm Abby and I'm a council member.
And we're here today to talk to you about some tips and tricks for working with young people here in health settings. So thank you so much for joining us, and we're going to jump right in. So, who is the CDHB Youth Advisory Council? We're formerly known as the YAC because it's a little bit easier to say, but we're a group of young people aged between 16 and 24 years old. There's 15 of us on the council currently, and some are either in high school or they're at uni, ARA, doing other tertiary courses, working, doing an array of other things essentially, and we all have a common purpose in that we want to advocate for young people here in our health system. We either have our own experience in the health system or we have a family member or a friend that we advocate for instead, and we are the only youth advisory council in the country, so this is something that we're really proud and passionate about with the YAC.
So the YAC's purpose is to give a voice to the 12 to 24-year-old youth people in Canterbury. We've observed that there seems to be a lot of youth voice lost within the system, so we want to create a safe and inclusive environment for all young people to get the healthcare that they need and deserve. So we do this through a range of different projects. We do advocacy, create resources, work with health professionals and things like professional development, making services better for the people like us who are going through the healthcare system and deserve the best care that they can get.
So some projects we've got going on for 2021 is on the screen, as you can see. We're not going to touch into these points for this presentation, but if you'd like to know more, please do get in touch with us and we'll let you know. Some of the key ones I'll point out though is we do offer professional development like we're doing today. So if you are in Canterbury, we can come see you in your service and provide some professional development about youth friendly services or how do you work with young people, things like that. So we can offer those. If you're nationwide, I'm sure we can figure out a way to do it by Zoom or do some pre-recordings and stuff for you so that you can get access to these offers as well, because we want to make sure that across the country we're supporting our young people in our health system. Other ones that we do are things like youth health resources, so we're really passionate about this. We did a series called YAC Yarns last year, which is up on our YouTube, so these are little 30-minute clips with health professionals in their different areas, and it gives some really useful information for young people about these different areas in the health system, so they know a little bit more about what's going on.
So how can we improve young people's experience in our health system? This is a question we get asked a lot because it's basically our big focus and our big goal. And so some of the ideas that we're going to share, the little tips and tricks, may seem super simple, but we recently ran a survey with the youth of Christchurch asking what they found really, really effective and what really didn't work so well for them within their health experience. And so we used this for a project that we're working on to present to local nurses here in Canterbury, and we've also used it to inform the rest of our presentation today. So let's get into it.
Cool. So as we know, we're talking to nurses, so we know that you know that adolescence is a really crucial development period. We think it's really important to frame our conversation for the rest of our presentation around this point, because as you know, 12 to 24-year-olds, it's quite a huge age gap. There's so much going on for a young person at this time. You know, they're dealing with relationships, friendships, school, uni. There is so much going on for a young person that we need to really be mindful of this when we're in the health system, because they've got so much going on in their world that health may or may not be their biggest priority. And so, yeah, crucial development period for physical, cognitive and socio-emotional. So this is actually probably the most crucial development period as humans. We know the brain is not fully developed until they're 25 for females and 27 for males. So I think this is incredibly something to be mindful of when we're in the health system, is that you're dealing with people that brains are not fully developed yet. And so this is actually something we should think about when we're speaking to young people, how we talk, how we work with them. Because we know executive function is still being developed, which is really crucial for things like making decisions, being independent, things like that, which they're on the verge of being, but not quite there yet. And then, of course, egocentrism is also a key part. You know, we're trying to find out where's our identity in the world, who are we, what's going on. All of this is going on. So it's a time of exploration for these young people, which we should be super mindful of in how we give our care to young people, because we want to make sure that we're not judging our young people, but rather educating them on their, if you've got any concerns or something about their behaviour.
So communication is truly one of the most important things, and it can make or break a young person's health experience. So something that's really major, just be really cautious of talking down to a young person. It may feel easy to baby them, but being condescending is not helpful in any way, and often people don't mean to, but just being aware of this and making sure you're speaking directly to the young person. They're ultimately the person that you're there to help. And so while there may be caregivers or whānau, parents, anyone in the room, try not to ignore the young person, even if it may seem easier to talk to the older person or the adult in the room. It empowers a young person to be the driver in their own health. The use of lay terminology is absolutely crucial. It's really easy to throw out big terms, especially when you're so used to spending all day talking about things with other medical professionals, but a young person will just disengage if they don't understand. So explain what blood test you're doing, why you're doing it. Taking a little bit of time out of the appointment to make sure that someone really understands is just so beneficial. Reframing questions to things like, how can we help you and what do you need from us, just puts the ball back in the young person's court and makes them feel like they're valued and what they're there for actually matters. Another wee tip we think works really well is just having a little notepad or a piece of paper to just hand over to someone if they feel like they can't verbalize something or embarrassed, particularly around topics that have a bit of a stigma around them, unfortunately, like mental health, sexual health, just these things sometimes are harder to talk about. So if you can ask someone to write it down, it can be really useful, and then you can talk about that in that appointment, or if you have availability to have another appointment and bring it up later on if you need to get some info or find out more, that's absolutely fine. But overall, communication is key, and it's something we really focus on a lot in our professional development sessions.
So appointments are another way that we can look after our young people in the health system. So one of the key things that we suggest is giving a young person some time to open up. Now we know as nurses, you probably don't get to dictate how long you get to see a young person for, or how many times you get to see a young person for, but if you can, we really suggest giving extended appointments or booking a follow-up, because a young person is probably not going to be able to tell you straight away why they've attended an appointment today. This can be, you know, confronting and scary to turn up and suddenly share everything that's going on. So we can ask you to consider extending your appointments if you can for a young person. If you can't, book a follow-up, whether it's a 5-minute phone to check in on how they found that appointment or an in-person one again. But doing something like this so a young person has some space and time and don't feel rushed is really crucial. Working together is another huge important point. It might seem incredibly obvious, but this allows you to empower a young person to make informed decisions about their own health. This is really important. We want young people to feel empowered in their health. So asking questions like, what do they want from this appointment? What is the reason they have turned up to your room today, and getting to find out what's that common goal, because you'll have some decisions or ideas that you want to suggest. What do they actually want to? And then you can work together on this common goal, which is super important. Confidentiality, we know this is really important. We know that this is very crucial in a young person experience in the health system. So we ask you to always bring it up with a young person. Remind them that this is confidential. But if you need to break it for any reason, just explain why. Explain why you have to breach it. Provide rationale. That's all a young person needs, is to know why you have to break it. It's not up on here on the screen, but if you are late to an appointment, again, we know sometimes you don't have any control in that. So if you're late, simply just walking into a room and apologising for why you're late values a young person and their time. It might seem super obvious to do this, but it's actually something that can make or break an appointment too, and feeling that you value a young person. And finally, we always suggest that you should make sure you get some time alone with a young person in the room. So if they've come with a caregiver or a whānau member or friends or whoever they've come with, try and make sure you can get some alone time with this young person. So this can be seen by taking them out of the room to get their height or their weight measures or even doing their blood pressure. You might already be able to do this in the room that you're in, but taking them out of the room means that you can ask them questions without these other people being around, and you might actually get some more honest responses too. And this actually breaks some of the barriers that we've seen where if young people are in the room and parents have been told to leave, they might get confronted at home about these questions. So we just encourage you to really do this as well.
So building rapport is super, super key to having a good appointment and making sure a young person feels listened to and respected. So it can be super distressing. It can be really vulnerable to share whatever's going on in a young person's life, and this is why building rapport is so, so important. So firstly, something that we really encourage that is really often overlooked and is quite simple is just getting to know a young person for who they are, who they present as, who they are in the moment, and not basing them on preconceived ideas about who they are based on their medical records and their medical notes. And this can be done by actually just sitting and listening to them, not reading through notes or thinking about things, just actively listening. And if you're not sure what this is, you can have a look on the internet. There's heaps of research about it. Have a little look and you'll see pretty quickly. Not hard to do, just actively listening to the young person in the room, and being aware of the power imbalance that already exists within the relationship is so important. And we know these professional boundaries, confidentiality, and we don't want to break any of those boundaries by saying, this is my phone number, this is where I live. But opening up the appointment with some dialogue about something that isn't health related can really, really just change things, make someone feel more at ease, less anxious about what's about to happen. So just saying, I watched this movie last night. Have you been watching anything on Netflix? Or I went out for dinner. What's your favorite restaurant around here? Just little things like that where you can connect on a level that isn't about medicine and health can be so beneficial. We cannot express this enough. Asking a young person how to pronounce their name correctly, if you're the slightest bit unsure, it makes them feel valued, like they're a real person and not just an appointment slot or their medical history. And asking what name they prefer to go by. Sometimes this isn't their birth name or isn't what you expect to be, but it can make them, again, feel really valued. And same as this is asking someone what their pronouns are, and introducing yourself with your own pronouns can also make such a difference. And it's something we should all be doing all the time anyway to create a safe space. So just saying, hey, I'm Abby, you can call me she, her, just sets it up and makes someone feel comfortable to tell you their own pronouns. Noting these down, both name pronunciation and pronouns, means that you actually care and you want to remember, and it's not just something you're doing to please them in the moment. And we know nurses are the kindest and friendliest people, and we constantly hear and experience the kindness that you all show, but it's so important and we really appreciate it.
Cool. So creating a safe and youth-friendly environment, of course, is key when working with young people in the health setting. So as we talked about just before, Abby's already briefly talked about it, introducing yourself as you walk into the room is really important. Again, seems like a real obvious thing, but can be hit and miss, especially if health professionals are running into one room into another. Sometimes they'll simply forget this act of introducing themselves. What's their name? And sharing your pronouns is really crucial too, because then a young person feels safe, they know that you respect them, and this also can actually allow for you to create a really informal setting rather than it being really health and clinical. It can just be super informal, having a chat about what's going on. Other things you can consider is lighting. This is something, again, that's really simple, but can make a huge difference for those that have sensory issues, that struggle with overstimulation. Just considering the lighting is really crucial. When we think of toys in health settings, we generally think of having toys in like waiting rooms and things to keep kids distracted. However, actually having sensory toys available in your clinic, so whether that's in your waiting rooms or your clinical rooms, actually can be really useful for young people. So if you don't know what sensory toys are, they're pretty common these days. There's things like fidget toys, there's the little poppet squares things that are going on. There's an array of sensory toys that exist out there that you can get, and you can put them into your clinic and waiting rooms, and basically that means young people can distract themselves, it can ease anxiety, it can help with overstimulation. So something so simple yet can make a huge difference for a young person experiencing the health system. And again, we hope that our entire health system is like this already, but making sure that the space is accessible is another super crucial point. And we also encourage having posters on the wall. So these posters should support young people. They should support our communities, like our LGBTQ plus communities, our migrant communities, our different culture. We should have them in different languages, just creating a space where everyone feels included and safe and welcomed into the environment is really important and can make a huge difference.
Some things to consider. We always support a haura approach to health and wellbeing, and te whare tapa whā should always be considered in how to approach an appointment and a young person as they present to you. Something else we get you to think about is being sensitive and mindful of the past experiences that some young people will bring to an appointment, especially if they have experienced any type of trauma, including medical trauma, sexual abuse, any kind of family or domestic violence is really important, as this can cause some different reactions. And you may just need to operate slightly differently and be more sensitive around things to make sure that they're feeling really, really comfortable. This can even be seen in things such as asking to take a blood test, asking them what arm do you prefer, do you have a particular vein that you usually get blood taken from. This can be really appreciated, especially for someone who's getting these tests regularly. Just acknowledging that and asking for their preference. And something else to consider is also just asking for consent to touch someone. It's something you probably do every day, all day, but just saying, oh, I'm just going to grab your arm now to put the blood pressure monitor on it. Is that all right? Do you mind? Can be so appreciated, especially for people who can get overwhelmed by sensory things or by physical touch and contact. So consent is something we really encourage. Something else we really encourage everyone to do is just acknowledge your own biases. We all have them. And work on treating the young person as the expert in their own life. It's their life in the end, and yeah, it's really important. Making sure a young person leaves their appointment knowing when their next appointment is, what the plan is going forward, who they can contact, if they've got new medication, what's it for, how to take it, where are they going to get it, will it be faxed to their pharmacy, are there going to be any side effects, when do they take it, and what to do if they have any concerns at all. Just making sure that they feel like they can leave feeling like they are in charge of their own health is so empowering for a young person. And young people will always remember health professionals that were empathetic and went out of their way to help them, especially if it's a time where they're at their lowest. You're not going to be forgotten, not at all.
And some other little pointers, again, we brushed on this at the very beginning, but coming from a place of non-judgment is so crucial. We know that young people will probably be partaking in some risky behaviour, so rather than judging and condemning them, just come from a place of care, come from a place of concern and ask them what's going on, rather than judging them is probably one of our big points. Beware to not dismiss concerns. Again, this is probably a really big one that we have come across when working with young people. Dismissing concerns, especially symptoms like pain. Unfortunately, we do hear phrases like, it's all in your head, or have you tried yoga? And although yoga definitely has its place, it's not always helpful in this setting to talk about it in this way. So we just ask and encourage that you just listen to a young person, listen to their concerns, see what they think is going on for them. And another huge one is avoiding blame on health conditions solely on weight. So this one may seem controversial because of course we know weight is actually involved in some health conditions. However, we also know that adolescence is a time where body image, self-image is a huge struggle, and we actually know that a lot of eating disorders actually present at this time and period of someone's life. So instead of asking to get them weighed every session, see if you can avoid doing that if possible. Asking them if they want to be weighed is really important too, because some of them might just not want to, and that's actually okay. We know you have to operate in some way, which sometimes you actually have to do that, but if you can try avoid it or not make everything about their weight, that's actually really important so that we don't degrade a young person. Things like, again, following through with promised scans, appointments, things you said you were going to do. Again, this might seem obvious. You're probably all already doing it in your practice, but it actually can make or break an experience for someone because, if you're not following through with scans and appointments and things, they might just actually not want to come back, and we don't want to have that going on. So we really encourage that one. And as Abby's said already, you can make a huge difference in a young person's life. So you are very valued, but these are little things that you can consider to make it even better.
So to finish the presentation, we just want to leave you with a quote from a TED Talk that's our favourite and we recommend watching. It's just, every young person needs someone who makes them feel like a somebody when they feel like a nobody.
So there's many ways that you can keep in contact with us. We're super active on our social media and on our email platform, so please do get in touch if you've got any questions or concerns, and we'll happily reach back out to you about what's going on and whether we can help in any way. So thank you so much for having us. We really appreciate your time, and if you've got any questions, now's the time.